I'd never met John McDermott until I saw him in the hospital. He was being treated for bacterial valvular endocarditis, and I was consulted in order to help determine the best plan for his treatment. Endocarditis is where one of the heart's 4 heart valves gets infected, and usually from bacteria that have entered the bloodstream from another source. It could be from an infected joint, from the colon, from urologic infections, from teeth is a very common source. Those infections become severe enough to enter the bloodstream, and the heart valves are sort of predisposed to catching some of those bacteria and becoming infected themselves. And so he had an infection of his aortic valve and possibly also his mitral valve. My name is Bob Helm. I'm Chief of Cardiac Surgery at Portsmouth Regional Hospital.
So I had been extraordinarily healthy for my age, started having shaking chills and feeling ill. After the chills, my fever would spike to 103. But I went from swimming butterfly and thinking I was 30 years younger than my real age to a near-death experience, literally in days. My friend, Jean McGuire, sensed that something was wrong, came over, and she talked me into coming into the emergency room. I met Dr. Helm fairly early on after it was obvious that I was probably going to need heart surgery. He came by and visited. The team was wonderful. They got right on it. I got intravenous antibiotic. A wonderful infectious disease doctor as well, Dr. Al-Haddadin, took over the management of this unusual infection, and he was very thoughtful, very aggressive with the intravenous antibiotics, which is very important. My name is Dr. John McDermott. I'm actually a retired cardiac surgeon. I live here in Portsmouth.
Operating on John as a cardiac surgeon was ultimately a very fulfilling experience. He was not just any cardiac surgeon. He had trained at the best institutions at Mass General and then had gone down to Texas Heart, had worked with Denton Cooley and DeBakey, and he was trained in the best centers and then had a very busy, successful practice down in the Washington, D.C. area. He had retired up to this reason, as a lot of people do because the Portsmouth area is so beautiful, and was just living his life when this happened. What struck me about John is he was a lot like me. He was very meticulous. He insisted on perfection, and I could tell. He described how he does an operation, and we talked about the operations and how we do it, and it quickly became apparent that we were kindred spirits and that we were both out to do the perfect operation on every patient that we touched. For aortic valve replacement, there are 3 options. They're really options in respect to how invasive the procedure is. The standard operation was to divide the sternum from the sternal notch all the way down to the xiphoid. A pretty big incision and spread all the way, and you got great exposure. What we found, and I found, and I've become sort of an expert in this, is how can we do the same operation through a less invasive approach? And so what we do is called a mini sternotomy. It lets you do the operation through an incision that basically is about this big, okay? It's only about 2 inches long, and yet you do the same operation. And because you don't divide the whole lower half of the sternum, just the upper part, and you don't spread the chest as much, there's much less pain and a much faster recovery. Usually what I fix is a mechanical problem. It's very mechanical. And we have technology and techniques that can repair the abnormality and bring patients back to normal heart function. And that's what happened with John.
And it was clear in meeting Bob that we were very kindred spirits and had resonant commitments to excellence and to the protection of the patients through what is a potentially very dangerous journey.
I expect John to live a full and happy life, and I believe that we will have put this episode behind him successfully.